Health to Life News.
More consumers are looking for information about ways to stay healthy and stave off disease. And each day, new information is released about nutrition and its role in preventing cancer. For both consumers and health professionals, wading through all the research and trying to decide fact from fiction can be daunting, Tim Byers, MD, MPH, professor of preventive medicine at the University of Colorado in Denver, tells in an interview. Within the science and medical fields, randomized controlled trials are considered the gold standard for research. In this type of research, the participant may receive a placebo or the intervention, drug, supplement, or treatment being researched. Some involve double-blind studies where neither the researcher nor the participant knows who received the placebo and who receives the treatment. In an effort to review the knowledge gained from randomized controlled trials thus far, Byers recently reviewed a number of studies designed to see if diet can prevent cancer. The review, published in the November-December issue of a journal published by the American Cancer Society, presents results from numerous randomized controlled trials spanning stomach to esophageal, lung, breast, prostate, and skin cancers, as well as colorectal tumors. Many recent randomized controlled trials have failed to support researchers' assumptions in nutrition and cancer prevention research. With such disappointing findings, Byers stresses the importance of using the results of observational research along with randomized controlled trials. Observational studies look at large groups of people over time, rather than prescribing specific diets or therapies to test. By observing larger numbers of people's lifestyles, trends and associations between diet and health can emerge. Byers told that, although randomized controlled trials are regarded as the Cadillac of study designs, I don't think we can really view them that way at this point in our history as definitive answers about nutrition and cancer. And we're going to need to continually rely on good observational research in order to make inferences about lifestyle factors and cancer risks. According to Byers, observational research has provided strong evidence that consuming 5 or more servings of fruits and vegetables per day can significantly lower the risk of many cancers commonly seen in the U.S. As many as 2/3 of cancer deaths in the U.S. are linked to tobacco use, poor diet, obesity, and lack of exercise. The review notes that for economic and research design reasons, it is difficult to conduct randomized controlled trials with whole foods and that nutritional supplements are well suited for testing in trials. However, Byers points out some limitations of randomized controlled trials. For example, they only answer narrowly defined questions, the studies cover relatively short time periods, and they use a typical drug model testing high doses of a single nutrient, failing to properly demonstrate the relationship of diet and cancer with regard to whole foods. We need an era of large trials using multiple nutrients in combination if we're really going to get much success out of randomized controlled trials, says Byers. Despite their limitations, the large randomized controlled trials have occasionally yielded unexpected results. Through the alpha-tocopherol beta-carotene study, it was discovered 50 IU of vitamin E may reduce the incidence of prostate cancer and that high-dose supplementation of beta-carotene may produce adverse effects in some situations. And, although skin cancer rates were not measurably affected in the nutritional prevention of skin cancer study, fewer cases of colorectal cancer and prostate cancer were seen in the nutritional intervention groups. Within the medical community, randomized controlled trials carry much weight, influencing the judgment of doctors. Byers writes, disappointing results from randomized controlled trials should not distract us from counseling patients on the basis of the extensive database that already exists from observational studies. The combined effects of nutrients as contained in the mixtures commonly known as whole foods seem to be more effective in reducing cancer than are nutrients contained in supplements. In an accompanying editorial, Dilip G. Baul, MD, Gerald L. Woolam, MD, and John R. Seffron, Ph.D., write, cancer is largely a preventable illness. Nevertheless, public awareness of the opportunity to prevent cancer in this way is still sadly lacking. In contrast, public concern about environmental carcinogens remains out of proportion to the true risk and is one of our more persistent and enduring myths, diverting attention from larger, more common risks. Gerald L. Woolam, MD, President of the American Cancer Society and Director of Surgical Oncology at Joe Arrington Cancer Center in Lubbock, Texas, tells in an interview, I think what the randomized trials can tell us are details about how long it might take to change a person's risk once you change his or her diet. We don't know that at the present time. But we do know populations that have adequate fruits and vegetables, maintain low fat and high fiber have lower risks of cancer. So I think physicians can be on sound ground in saying that if people want to affect their risks of cancer, they should do those things.